We're with Objective Surgical, and we provide work comp surgery bundles for the entire episode of care.
A little background and history of Objective began in 2009 with our owner and founder, Dr. Robert Grigori. His practice of Objective Medical, an IME, expert testimony. He's an expert with causation and with impairment ratings and in the work comp space, and led into 2011 where we began Objective Diagnostics. So we handle everything from scheduling to sending results in a timely manner. We're not a call center. It'll always be someone that you reach and have that customer service level. So in the end of 2014, we had the idea of doing the same thing for the surgical side in that episode of care. So we piloted with one surgeon, and in 2015, we began expanding outside of just Indianapolis and adding more specialties, more providers, bundling that episode of care. I started with the company in early 2015. I've been working to grow it since then.
He likes to say he's been here a lot longer than me because I started in 2016, but we have worked together for a long time and built a really great relationship, and that's actually the foundation for our company, how we have built our team, how we've built relationships with our clients, our providers. It's our entire culture.
We strive to do everything, do it the right way with every aspect of what we do, and doing it as a team.
So how does it work? We bundle the entire surgical episode of care from initial evaluation, where causation is addressed, and we include everything until that patient reaches MMI, except for pharmacy. We build a quote based on the surgeon's protocols that are specific to that patient and their comorbidities. We provide that quote prior to surgery to help the adjuster set reserves, and we help facilitate that entire episode of care.
We build each global quote specific to that patient, to their comorbidities, to the surgeon protocols, if there's conservative treatment or if surgery is advised, and what procedure codes, CPT codes, or diagnosis codes, what facility they will perform the surgery, even down to the hardware and implants, where we don't try to dictate or ask the surgeon to use a certain type of hardware because it's a better deal for us. It's the surgeon's outcomes, and that's what we want to follow. They're work comp savvy. They know that they know what to do best for the patient. So we build everything around those protocols, even down to the therapy, post-op therapy. We send that global quote and explain each of those pieces for the adjuster so they can help set reserves like Angela had said. Once surgery is performed, because with something like a complex shoulder, you're going to have CPT codes that change or added on or become less complex. When we get the op report and the claims, we see what was advised versus what was performed. And we reconcile that global quote if anything did change, and that's reflective of what the global invoice would be. So once all of that is provided, then we send that global invoice. So the adjuster, the employer, they're getting one bill from us.
We're able to provide surgical services in 5 states. We started in Indiana and Indianapolis, and we've expanded our entire network from Indiana to Iowa, Missouri, Kansas, and Oklahoma.
And we would love to do it in every state. We've been asked about that, but we really try to focus on what we like to refer to as the Wild West. So states like Indiana, Missouri, and Iowa, where there's no fee schedule, there's no real structure. You can still direct care. There's no cap or limits on the reimbursement amounts would be for each provider or vendor. Other states where you can direct care, like Kansas and Oklahoma, where the fee schedule is more of a moderate fee schedule, where we can still add value, because at the end of the day, that's where we're wanting to be, is to make sure we're adding value to our clients and to our provider partners.
There is the possibility to grow our network in other states, but it's dependent upon those things David mentioned, like directing care and fee schedules.
We love to hear from our clients of where they have needs and what states. We always want you to reach out and to ask those questions, and we'll dive into researching the fee schedules and the direction of care and other pieces that go along with those states, and see if there is a possibility where we can help on both sides.
It's also important to note, as we talk about directing care, that the adjuster or nurse case manager who's ever sending that referral to us still directs the care. You choose the doctor, you choose the physical therapist. We're able to facilitate that and make it happen within our network.
And speaking of our network, when we do expand and grow the network, it's not just one surgeon within a group. In the contract phase, we add all surgeons from a group that treat work comp. And when we make sure that they are first in work comp and that they have that knowledge to be able to address causation, impairment ratings, work restrictions, things like that. And some of the benefits to our provider partners are through our program, there are no fee disputes, there are no appeals, reconsiderations, any hassles like that just waste time. In addition to that, when we receive the claims, we process and pay them. We do not wait for our clients to pay us. We don't wait 60, 90 days. We're making sure to get the payments and reimbursement processed and sent within 30 days.
Another part of our special sauce is how we actually make it happen. We have care coordinators who are assigned to each file upon referral, and they become an assistant to the adjuster or nurse case manager on the file. And this was designed to facilitate a quick episode of care to save the adjuster and nurse case manager time. So we are able to provide multiple levels of support. We can actually facilitate all patient communications, scheduling, everything associated with that episode of care. If a nurse is on the file and they prefer that we just facilitate, back-end administrative and provide the cost savings, we can do that as well. It's all customized per that referral source. But the same care coordinator follows that file from the initial eval until that patient reaches MMI, and they become a great support for that adjuster or nurse on the file.
So we've heard about the time savings. Now let's talk about the cost savings. So for states like Indiana, Missouri, and Iowa, where there's no real state statute or fee structure or fee schedule, we are typically saving between 30 and 50% off of billed charges or usual and customary. Now, states like Kansas and Oklahoma, where there is a fee schedule, we're always below fee schedule. And that could be anywhere from 5% below up to 25% or more.
This is where I have to jump in and say that this is also inclusive of our services that are provided. There are no additional bills associated with our program. Everything is built into that one global invoice. Next steps are easy. If you would like to learn more about our program and what advantages it can provide to you and your clients, you just schedule a call with me and my team.